Welcome to my channel. In this video, we will explore gastroesophageal reflux disease, or acid reflux, its symptoms, risk factors, treatment, dietary and lifestyle modifications, and complications if left untreated. But before we begin, don't forget to hit that subscribe button and the notification bell, so you never miss any of our informative videos. So let's dive right in. More than 60 million American adults have heartburn at least once a month, and more than 15 million adults have heartburn every day, including many pregnant women. Gastroesophageal reflux disease, or chronic acid reflux, is a condition in which acid-containing contents in your stomach persistently leak back up into your esophagus, the tube from your throat to your stomach. Many people may experience acid reflux, or heartburn from time to time. However, if you experience acid reflux symptoms more than twice per week, you may have gastroesophageal reflux disease. Gerd can present with a variety of symptoms. Here are some common symptoms to watch out for. Heartburn or burning sensation in the chest, often after eating or lying down, is the most common presentation. Regurgitation, that is, the sensation of acid or food coming back up into the throat or mouth, can also occur. Persistent coughing, often at night, can be a symptom of Gerd. Irritation of the vocal cords can lead to hoarseness or voice changes. Due to esophageal damage, some individuals may find it hard to swallow or experience a feeling of a lump in the throat. To properly manage the Gerd symptoms, it is very important to understand Gerd and its risk factors. Gerd occurs when the lower esophageal sphincter, a ring of muscle that separates the stomach from the esophagus, becomes weakened or relaxes inappropriately. When you swallow, lower esophageal sphincter relaxes to allow food and liquid to flow into your stomach. Then the sphincter closes again. If the sphincter does not tighten as it should, or it weakens, stomach acid can flow back into your esophagus. This constant backwash of acid irritates the lining of your esophagus, resulting in the development of the symptoms. Conditions that can increase your risk of Gerd include obesity, hiatal hernia, that is bulging of the top portion of the stomach up above the diaphragm, making it easier for stomach acid to flow into the esophagus. Pregnancy, as hormonal changes during pregnancy can relax the lower esophageal sphincter, leading to Gerd symptoms. Connective tissue disorders, such as scleroderma. Factors that can aggravate acid reflux are smoking, as it weakens the lower esophageal sphincter and increases stomach acid production. Anxiety and stress increases the production of acid in stomach. Drinking alcohol may increase the risk of Gerd. Eating large meals, or lying down immediately after eating. Certain medications like non-steroidal anti-inflammatory drugs, such as aspirin and ibuprofen, and iron supplements. Some foods may trigger Gerd symptoms, such as spicy foods or foods with high fat content like fried and fast food. Coffee, tea, and carbonated drinks can also aggravate the Gerd symptoms. Now let's jump over to the treatment part of acid reflux disease. Lifestyle and dietary modifications play a crucial role in managing Gerd. These changes should be tried before starting any medications. Let's dive into these modifications in detail. Dietary modifications include avoiding trigger foods. Certain foods can relax lower esophageal sphincter or increase stomach acid production, making reflux more likely. Common trigger foods include citrus fruits, which are high in acid and can irritate the esophagus. Tomatoes, also acidic, and can relax the lower esophageal sphincter. Spicy foods may irritate the esophagus and exacerbate symptoms. Chocolate, caffeine, and carbonated drinks. These can relax esophageal sphincter and stimulate acid production. Fatty and fried foods can slow digestion, leading to significant acid reflux. Take smaller, more frequent meals. Instead of 3 large meals, opt for several smaller meals throughout the day. This reduces the pressure on lower esophageal sphincter and helps prevent overeating, which can trigger reflux. Limit alcohol. As alcohol relaxes lower esophageal sphincter and can increase stomach acid production. Reducing or eliminating alcohol intake can significantly improve Gerd symptoms. Watch your timing. Avoid eating within 2 to 3 hours of bedtime. Lying down with a full stomach makes it easier for stomach acid to flow into the esophagus. Lifestyle modifications include maintain a healthy weight. Obesity and excess abdominal fat can put pressure on the stomach, leading to reflux. Losing weight through a balanced diet and regular exercise can alleviate symptoms. Elevate the head of your bed by 6 to 8 inches. It can help gravity keep stomach acid in the stomach while you sleep. Don't lie down immediately after eating. Give your body time to digest food before lying down. Taking a walk after meals can be beneficial. Quit smoking, as smoking weakens lower esophageal sphincter and increases stomach acid production. Quitting smoking not only improves GERD, but has numerous other health benefits. Manage stress. Chronic stress can exacerbate GERD symptoms. Engage in stress-reducing activities like yoga, meditation, or deep breathing exercises. Avoid tight clothing. Wearing tight belts or waistbands can increase abdominal pressure, leading to reflux. Opt for looser-fitting clothing. If you are liking the video, please hit the like button, so YouTube can spread this video to others as well, and comment to share your experiences and GERD stories. Medications are common and effective treatment approach for GERD. They work by reducing stomach acid production, neutralizing acid, or strengthening the lower esophageal sphincter. Proton pump inhibitors, or PPIs, are the most potent acid-reducing medications. They block the production of stomach acid by inhibiting the proton pump in the stomach lining. Examples include omeprazole, lansoprazole, pantoprazole, rabeprazole. These are typically taken once daily before a meal, and they provide long-lasting acid suppression. H2 blockers reduce stomach acid production by blocking histamine, a chemical that stimulates acid secretion in the stomach. Examples include ranitidine, famotidine, cimetidine. H2 blockers are taken before meals or at bedtime. They provide shorter-lasting acid suppression compared to PPIs. Antacids are over-the-counter medications that neutralize stomach acid, providing rapid but short-lived relief from heartburn and acid reflux symptoms. Examples include Tums, Mylanta, Rolaids. These are taken as needed after meals and before bedtime. They are most effective when symptoms occur. Prokinetic agents help strengthen esophageal sphincter and promote more efficient stomach emptying, reducing the likelihood of acid reflux. Examples include metoclopramide, typically used when other medications are ineffective or in combination with other GERD treatments. They are taken before meals and at bedtime. Alginate antacids. These medications create a protective foam barrier on top of the stomach contents, reducing reflux into the esophagus. Examples include Gaviscon, typically taken after meals and at bedtime. They are often used in combination with other medications. In some cases, when medications do not provide adequate relief or are not well tolerated, surgical or endoscopic interventions may be considered. These procedures include Nissen fundoplication, Lynx device implantation, and endoscopic therapies like Stretta. They aim to strengthen lower esophageal sphincter or repair structural issues contributing to GERD. It's important to note that while medications can be effective in managing GERD symptoms, they may not address the underlying causes or prevent all complications. Long-term use of PPIs, in particular, has been associated with potential side effects, so their use should be carefully monitored and discussed with a healthcare provider. Additionally, the choice of medication and treatment plan should be tailored to the individual's specific needs and the severity of their GERD. Always consult with a healthcare professional for proper evaluation and guidance regarding GERD treatment options. Untreated gastroesophageal reflux disease can lead to several complications over time. It's essential to recognize and address GERD symptoms to prevent or minimize these potential complications. Here are some of the complications of untreated GERD. Chronic exposure to stomach acid can lead to inflammation and irritation of the esophagus, a condition called esophagitis. Repeated injury to the esophagus can result in the formation of scar tissue, leading to the narrowing of the esophagus or strictures. It can result in painful and difficult swallowing. Over time, chronic acid exposure can lead to changes in the cells lining the lower esophagus, also called Barrett's esophagus. People with Barrett's esophagus have an increased risk of developing esophageal cancer. GERD can lead to aspiration, where stomach contents, including acid, enter the airways and lungs. This can result in chronic cough, recurrent pneumonia, and worsening of asthma symptoms. Frequent exposure to stomach acid can lead to dental erosion, increasing the risk of cavities, tooth decay, and gum disease. Persistent hoarseness and sore throat can occur if recurrent acid reflux irritate vocal cords. GERD symptoms often worsen at night, disrupting sleep patterns and leading to fatigue and decreased quality of life. It's important to note that not everyone with GERD will develop these complications, and the severity of the condition varies from person to person. However, recognizing and managing GERD early with lifestyle changes, medications, or in some cases, surgical interventions can help prevent or mitigate these potential complications. If you are experiencing symptoms of GERD, such as frequent heartburn or acid regurgitation, it's crucial to consult with a healthcare professional for an accurate diagnosis and appropriate treatment to prevent the progression of the disease. If you found this video helpful, hit the like button, share it with your family and friends, comment to share your experiences, and subscribe to my channel for more health-related videos.